Hi guys, it's your next door nurse Florence and you're welcome once again to my channel where we talk all about emergency health and wellness tips. In today's video, we're going to be talking about colon cancer. We're going to be talking about its definition, we'll talk about the causes, the risk factors, the diagnosis, the signs and symptoms, the prevention and the treatment. But before we go into colon cancer proper, I'd like to give us a brief overview of the colon and its functions. Don't go away. The colon, also known as a large bowel or large intestine, is part of the digestive system in the human body. The human colon is a muscular tube-shaped organ measuring about 4 feet long. It extends from the end of the small bowel to the rectum. The digestive system is the group of organs that allows us to eat and to use the food we eat to fuel our bodies. Parts or segments of the colon. The ascending colon, which plays a role in absorbing water and electrolytes. The transverse colon, the descending colon that is responsible for storage and evacuation of stool, and the sigmoid colon, which connects the rest of the colon to the rectum and it ends in the anus. The term colon, colorectum or colorectal are considered interchangeable. Functions of the colon. 1. To digest and absorb nutrients from food. 2. To concentrate fecal material by absorbing fluids from it. It also dissolves electrolytes. 3. To store and control the evacuation of feces. If your colon is not working the way it should, you may experience problems such as bloating, pain, constipation, diarrhea, and even cancer. Colon cancer is a transformation of the normal cells in the colon. The transformed cells grow and multiply abnormally. Most colon cancers are adenocarcinomas, that is, they are tumors that develop from the glands lining the colon's inner wall. It is sometimes referred to as colorectal cancer, reflecting the fact that the rectum can also be affected. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as small non-cancerous clumps of cells called polyps that form on the side of the colon. Over time, some of these polyps can become colon cancers. The cause of colon cancer is unknown. In general, colon cancer begins when healthy cells in the colon develop changes in their DNA. Factors that may increase one's risk of colon cancer include 1. Older age. The majority of people affected with colon cancer are usually age 50 and above. 2. African American race. These sets of people have a greater risk of colon cancer than do people of other races. 3. A personal history of colorectal cancer or polyps. 4. Inflammatory intestinal conditions like ulcerative colitis can increase your risk. 5. Family history of colon cancer. 6. Low fiber or high fat diet. 7. A sedentary lifestyle. 8. Excessive alcohol consumption. 9. Obesity and diabetes. 10. Smoking. 11. Radiation therapy from cancer. Many people with colon cancer experience no symptoms at the early stages of the disease. When symptoms appear, they will likely vary depending on the cancer size and location in the large intestine. Some of the signs and symptoms include 1. A persistent change in your bowel habits, including diarrhea or constipation, or a change in the consistency of your stool. 2. Rectal bleeding or blood in your stool. 3. Persistent abdominal discomfort such as cramps or pain. 4. A feeling that your bowel doesn't empty completely. 5. Weakness or fatigue. 6. Unexplained weight loss. Some of the late signs include large amounts of bleeding from your rectum, especially if associated with weakness or dizziness. Unexplained severe pain in your belly or your pelvis, that's your groin area. Vomiting and inability to keep fluids down. When you notice any of the above symptoms, seek medical help without delay. Some of the ways to diagnose colon cancer include fecal occult blood tests, colonoscopy, flexible sigmoidoscopy, digital rectal examination, CT colonography, and air contrast barium enema. People with increased risk of colon cancer should screen before age 50, while those with moderate risk should screen around age 50. Some lifestyle changes to reduce your risk of colon cancer include 1. Eat a variety of fruits, vegetables, and whole grain. 2. Drink alcohol in moderation or stop it if you can. 3. Quit smoking. 4. Exercise most days of the week. 5. Maintain a healthy diet. If your colon cancer is very small, minimal invasive approach may be recommended. Some of these approaches include removing polyps during a colonoscopy, endoscopic mucosal resection, and minimal invasive surgery. For advanced stage colon cancer, colostomy can be done to create a way for waste to leave the body. There can also be nearby lymph nodes removal. Other treatment options include chemotherapy, radiation therapy, immunotherapy, targeted drug therapy, and supportive care. All these are done in the hospital. So when you see any of the signs and symptoms or you notice any of them, please seek medical help. So guys, we've come to the end of this video. I'm sure you've learned a thing or two about the colon and its functions and also colon cancer. If you find it helpful and useful, give a thumbs up by clicking on the like button. Please subscribe to my channel for free by clicking on the red subscribe button. Turn on the notification bell so you don't miss a thing. You can drop your comments or questions in the comment section below and I will attend to them. I remain your next door nurse and I'm just a mark away. I love you guys. See you in my next video. Bye.